Hello, friends! Is the world once again on the brink of danger? Is the 2020 coronavirus episode about to repeat itself? Is there going to be another lockdown? Let me inform you that since this morning, media outlets have been reporting that a new virus is spreading in China. While this virus was actually detected about 20 to 25 years ago, recent developments in China indicate a surge in hospital visits, with people complaining about chest pain, breathing difficulties, and related symptoms. This raises the urgent question: what is this new virus outbreak? And could it again put the entire world at risk? Let's delve into this in detail. To begin with, this is a respiratory illness, similar to what we witnessed during the coronavirus outbreak, where people experienced difficulty breathing and lung issues. The situation in China is raising alarm as hospitals are overcrowded, with reports of a state of emergency and epidemic surveillance in hospitals. The virus currently in focus is HMPV, or human metapneumovirus. However, it is not the only one. Viruses like influenza and others are also spreading rapidly in China and other parts of Asia. This is particularly concerning for countries like ours, where preventive measures need to be carefully considered. China's health authorities have confirmed that the virus is spreading rapidly in the northern regions, especially around Beijing. However, it is challenging to obtain accurate data from China regarding the number of infections, hospitalizations, or deaths. Social media reports suggest widespread issues, but official data is limited. HMPV primarily affects vulnerable populations, such as children, pregnant women, and the elderly. The situation is critical as these groups are at higher risk of severe complications, including pneumonia. The World Health Organization, WHO, has yet to address this situation in detail. If necessary, the WHO may declare this a public health emergency of international concern, PHEIC. Respiratory viruses, such as HMPV, affect the lungs. When inhaled air reaches the bronchioles, small tubes in the lungs, and alveoli, tiny air sacs where oxygen exchange occurs, mucus can accumulate, obstructing normal breathing. This is particularly dangerous for individuals with weaker immune systems, such as young children and the elderly. Symptoms often resemble those of the common cold, making early detection challenging. Therefore, proper testing and monitoring are essential, especially for vulnerable groups. Pneumonia caused by HMPV can sometimes be fatal if not treated promptly. In conclusion, this situation demands serious attention from global health authorities, including WHO, to assess and manage the risks. It also highlights the importance of vigilance and preparedness in combating potential outbreaks. The issue with such viruses and diseases is that there are often no specific vaccines available to combat them. This is the biggest challenge with HMPV, human metapneumovirus. No specific vaccine has been developed yet. In addition to HMPV, other viruses like influenza A are also spreading rapidly in China. Influenza A, a type of flu virus, affects both animals and humans, including birds and pigs. You might be familiar with outbreaks like swine flu or bird flu. This is a similar scenario. Influenza becomes particularly dangerous because it mutates rapidly. When a virus enters the human body, it multiplies, and sometimes its structure changes, allowing it to spread even faster among people. The primary risk of viruses like influenza is respiratory complications, including pneumonia, which are especially dangerous for high-risk groups like children, pregnant women, and the elderly. The concern being raised now is why a proper vaccine wasn't developed when these viruses were detected decades ago. However, just as vaccines were quickly developed during the COVID-19 pandemic, efforts may intensify if this virus spreads further, and a specific vaccine may eventually be developed. Government and health authorities, especially in countries like India, need to remain vigilant. Strict monitoring and adherence to public health guidelines are crucial. It's also essential to note that the virus is no longer limited to China. It has already spread to other parts of Asia. For instance, Japan has reported over 700,000 flu cases this season, with nearly 95,000 flu patients visiting hospitals in just 1 week. This indicates that the virus is rapidly spreading outside China and could potentially reach other countries, including India. Numbers, fatality rate, and prevention measures. As for the fatality rate, there is limited research so far. However, a Lancet Global Health study from 2021 suggested that the mortality rate for children under 5 affected by such viruses could be around 1%. For general prevention, masks. Start wearing masks in crowded spaces immediately without waiting for an official mandate. Vaccines. Ensure you're up to date with all recommended vaccinations. Diet. Focus on a diet rich in vitamins and antioxidants to boost your immunity. Avoid smoking. Smoking can exacerbate respiratory issues, making the lungs more vulnerable to such viruses. Stay hydrated. Drinking plenty of water is essential to keep your body hydrated and combat health issues. Seasonal concerns. Winter is a peak season for respiratory issues due to mucus buildup and breathing difficulties, making it easier for such viruses to spread. Officials believe this could escalate the problem further.